Everything you've done for your back pain has been working on the wrong part of your body. I want to show you why and what to do about it instead. The moment before you stand up this morning, you're sitting at the edge of the bed waiting to find out what kind of day your back is going to give you. That pause has been there a long time, and the reason it keeps coming back isn't what you think. I'm going to show you three specific muscle groups responsible for your lower back pain, why they break down after 50, and how to reactivate them in 8 minutes every morning before you get out of bed. No equipment. You can start tomorrow. But the movements only make sense once you understand what's actually failing. Because if you skip that part, you'll do the exercises for a week and stop the same way you've stopped everything else. There are two things this video covers that most back pain content skips. The first is a specific structural imbalance, I'll name it in 3 minutes, that explains in one sentence why the stretches didn't hold and why the pain always returns to the same place. The second is stranger. There's a window every morning where your spine is most compressed and your supporting muscles are most vulnerable. And it's also the only window where you can stop the pain cycle before it starts. That one comes later, right now, why your back hurts. Picture a bridge held up by cables on both sides. One set of cables slowly loses tension over years. The bridge doesn't collapse, but it shifts. The remaining cables take more load than they were designed to carry. Eventually, the structure starts signaling that something is wrong. That is your lower back. The cables on one side, the gluteal muscles, the hip flexors, the deep spinal stabilizers, have been losing tension for years. Decades of sitting, the physiological changes of age, and your lower back, which was designed to move with support, has been doing the whole job alone. It is not broken. It is overloaded. Here's the part that explains everything. When an overloaded structure starts hurting, the pain shows up in the load-bearing piece, not in the pieces that stop doing their job. The back hurts, the glutes don't, the hip flexors don't. So everyone treats the back. The cables stay loose. That's the imbalance. One sentence, your back is doing a job it was never designed to do alone, which is why the stretches helped for 2 days. You were lengthening a muscle already carrying too much instead of addressing the ones that had stopped showing up. Something else I want to name because it rarely gets said out loud. At some point, the planning started. You began calculating before you committed to a chair, a car seat, a restaurant booth, how long you'd be sitting and whether you'd be able to stand. You stopped mentioning the back because people didn't quite understand why you couldn't just push through. You started making quiet decisions to skip things. That's not accommodation. That's a rational response to a structural problem. And structural problems can be fixed. Which brings me to the morning window. While you sleep, your spinal discs rehydrate and expand slightly. By the time you wake up, your spine is under more compression than at any point during the day. Simultaneously, the three muscle groups have been in a shortened fixed position for 8 hours. They are cold, they are stiff. Your nervous system, which has been monitoring your spine all night, is already preparing a pain response. The moment you stand up without addressing any of that is the moment the pain cycle locks in for the day. Most people stand up, check their phone, shuffle to the kitchen. Cold muscles, compressed spine. The back has decided the day before 9 a.m. 8 minutes before you stand up changes that entirely. The first movement, pelvic bridge hold. Lie flat on your back, feet on the mattress, knees bent. Slowly lift your hips until you feel a contraction through your glutes. Not high, not fast. Hold 5 seconds. Lower slowly, 8 repetitions. A glute that's inactive for 8 hours stays offline when you stand, and the lower back covers for it. 8 holds before you get up means the cables are already engaged before the load arrives. The second movement targets the hip flexors, the muscles running from your lower spine to the top of your thigh. After decades of sitting, they shorten. Short hip flexors pull the front of your pelvis down, which deepens the curve in your lower spine. More curve is more compression. Pull one knee slowly toward your chest. Hold your shin with both hands, other leg flat. 20 seconds. Switch sides. The third movement, spinal rotation. Both knees to your chest, then let them fall to one side. Arms out like a T, look the opposite direction. Hold 20 seconds. Switch. This is the movement that targets the paraspinal muscles, the stabilizers running alongside your spine that clench all night to protect you. The rotation creates space between the vertebrae, equalizes disc pressure, and releases that grip. Most people feel a quiet settling after this movement, something that was holding letting go. 3 movements, 8 minutes, before you've stood up once. Now, I want to show you what this actually does over time because the mechanism is interesting. David is 63, retired firefighter from Tucson. He had one benchmark: walk his dog for 45 minutes without stopping. He'd been stopping at 20 minutes for over a year. At day 14, he sent a message. He'd done the full walk, his exact words, almost embarrassingly simple, given how long he'd been looking for something that worked. Carol didn't come to this for the exercise. She came because the morning pause, the one at the edge of the bed, had been part of her life for 4 years after a car accident that never fully resolved. By day 10, the pause had shortened. By day 21, she told me it was gone. Neither of them healed a disc. What changed was the load distribution. 3 muscles came back online. The back stopped compensating. The back didn't change. The demand placed on it did. 3 muscle groups went offline. Your back compensated until the compensation became painful. The morning sequence doesn't treat the pain, it restores the job distribution. That's why it works where everything else worked temporarily. The person who started calculating chairs before sitting down, that wasn't aging. That was a rational response to bad load distribution. Now you have a different model, and a different model changes what's possible. Start tomorrow morning. Before you stand up, 8 minutes. If you want to go further, if the foundation isn't enough, or you want the full 21-day progression that adds rotational strength training and the sleep positioning work that stops the compression from rebuilding overnight, that's the back reset protocol. Every session is under 15 minutes. No equipment. Link is in the description. But the sequence you have now is real. Use it. The pause at the edge of the bed, waiting for your back to decide the day. That pause has already lasted long enough.